Panic attacks and mental breakdowns are two distinct psychological events that can significantly impact an individual's well being. A panic attack is an intense surge of fear or discomfort that peaks within minutes and includes symptoms such as a pounding heart, sweating, trembling, shortness of breath, and a fear of losing control or impending doom. On the other hand, a mental breakdown, also known as a nervous breakdown, is a period of overwhelming mental distress where a person is unable to perform daily tasks and may experience severe depression, anxiety, or stress. Treatment for these conditions often includes therapy, medication, stress management techniques, and sometimes lifestyle changes to help reduce triggers and manage symptoms. Risk factors for panic attacks and mental breakdowns may include genetics, personal history of mental health issues, stress, traumatic events, and certain personality traits. Here's a closer look at the detailed aspects of panic attacks versus mental breakdowns, shedding light on the nuances between these two forms of mental health crises. Onset speed, sudden versus gradual. Panic attacks are characterized by their abrupt onset, typically reaching peak intensity within minutes, causing intense fear and physical symptoms such as heart palpitations, shortness of breath, and dizziness. These episodes can occur unexpectedly or in response to a trigger, but they're generally short-lived. In contrast, a mental breakdown or nervous breakdown is a colloquial term describing a period of overwhelming mental distress. This condition doesn't have as clear a diagnostic profile as a panic attack, but tends to develop more gradually. It reflects a cumulative response to stress and may manifest through depression, anxiety, and functional impairment, often necessitating a longer recovery period with professional support. Duration, brief episodes versus extended periods. When differentiating between a panic attack and a mental breakdown, the temporal dimension is crucial. Panic attacks typically present suddenly and are fairly brief, lasting minutes to an hour. They are intense episodes of fear accompanied by physical symptoms like heart palpitations, shortness of breath, and dizziness. In contrast, what's referred to as a mental breakdown, more formally known as a nervous breakdown, is not a clinical term but describes a period of overwhelming mental distress that lasts much longer. Over days, weeks, or even months, an individual may experience a debilitating level of stress or anxiety that impairs their daily functioning, often culminating from chronic, unresolved stressors. Recognizing the difference in duration helps professionals tailor appropriate intervention strategies. Acute crisis management for panic attacks versus long-term therapeutic and possibly medication support for those experiencing an extended period of psychological distress. Primary manifestations, psychological symptoms versus psychological and physical exhaustion. When differentiating between a panic attack and a mental breakdown, it's vital to recognize that panic attacks are acute, intense episodes of fear accompanied by physical symptoms like chest pain, heart palpitations, and shortness of breath. They peak rapidly and are relatively short-lived. Conversely, a mental breakdown, or nervous breakdown, is a colloquial term describing a prolonged period of extreme mental distress where an individual cannot function in their daily life. It encompasses both psychological symptoms such as overwhelming anxiety, depression, or detachment, and physical exhaustion, where the body may respond with fatigue and a weakened immune response due to prolonged stress. Identifying the primary manifestations is crucial for appropriate intervention and support. Functionality impact, transient dysfunction versus prolonged impairment. When distinguishing between panic attacks and mental breakdowns, the scope of their impact on functionality is critical. Panic attacks typically involve sudden, acute bouts of intense fear and physical symptoms, such as heart palpitations and shortness of breath, but they are generally brief, lasting minutes to hours. The individual can often return to their normal activities relatively quickly. On the other hand, a mental breakdown, or nervous breakdown, is a colloquial term that describes a period of overwhelming mental distress where functioning in daily life becomes significantly impaired. This state can persist for days, weeks, or even longer, severely disrupting one's ability to work, maintain social relationships, and manage self-care routines. Proper identification and management differ vastly. with panic attacks often treated with on the spot techniques and possible preventative medication or therapy, while mental breakdowns may require more intensive, long term intervention, such as hospitalization or ongoing therapy. Stress response, acute anxiety versus overwhelming stress overload. A panic attack is characterized by a sudden onset of intense fear or discomfort, marked by symptoms such as palpitations, sweating, trembling, and a fear of losing control. It is an acute response to anxiety where the body's fight or flight mechanism is activated even when there's no imminent threat. In contrast, a mental breakdown, also known as a nervous breakdown, is not a clinical term, but often refers to a period of overwhelming stress that disrupts someone's ability to function in daily life. It encompasses severe stress, anxiety, depression, or burnout, manifesting through inability to work, withdrawal from social life, and intense emotional turmoil. Diagnosis hinges on the context, duration, and impact of symptoms, with remedies varying from immediate coping strategies for panic attacks to more extensive therapy and potential lifestyle changes for those experiencing a mental breakdown.